Well, doctors, earlier you were talking about a 2-week window for hospitals. Could you explain that to us? What exactly does that mean?
Yes, what that means is if our projections are followed, or if the projections are in line with what's happening with the trends right now, then we just have 2 weeks before the hospitals reach 70% critical care limit. So that's the critical threshold set by the Department of Health. So that's in the NCR. But right now we're hearing that many hospitals, many private hospitals are already full. Anecdotally, they're not accepting COVID patients anymore. Sometimes they're not even accepting other patients. So this is going to be a problem. And I just checked the latest data. I mean, 7,000 cases, pero 3,779 in NCR alone. I mean, this is really going to hit our, our worst nightmare. Yung projections natin, we could be seeing 4,000 cases per day right now by next week in NCR. This is unprecedented. We haven't seen this kind of surge in NCR. I mean, we really hope, we feel for our healthcare workers kasi they're going to be feeling, the strain of this surge. This is a nightmare happening to us right now. And to add to what Professor Ranjit Kunin said, if I'm going out, ang tingin ko ngayon, just to be on the safe side, I would treat everyone I encounter as potentially having the virus and act accordingly. I mean, I think that's the safest way. If you think that anyone you encounter can have the virus, then hindi mo na alisin yung face mask mo. You'll just, keep your face mask there. You could even wear 2 face masks if you're okay with it. Pero, that's the safest way. That's the safe play if you just want to protect yourself from getting COVID.
Yeah, parang suspect until proven innocent.
Exactly.
In a way. Actually, sir, magandang qualify ng doctors yung numbers ng NCR hospitals last week. While the numbers last week did not seem that alarming yet, pero they did confirm na napupuno yung mga big hospitals sa Metro Manila. And the big hospitals are the ones that are better equipped with more staffing. So yung mga hindi napupuno, yung mga hospitals na maliliit, which has less staffing and less resources. So that should also factor in whatever numbers that we have.
Right. And Ed, kanina we did a comparison of the hospital occupancy now compared to last August when we had the surge. Actually, mas marami ng hospital occupancy now in terms of beds occupied. It's just that the DOH and the hospitals were able to expand hospital beds and ICU beds. Dinagdagan nila, nadagdagan nila, na-scale up. Right. So, in terms of percentage, mas mababa ngayon. But in terms of the raw number, mas mataas na ngayon. And that shows na talagang this is a surge that's worse than last year because mas marami nang nasa hospital, especially sa ICUs. Our ICUs are almost at 70% critical level. Yung hospital beds, hindi pa. Pero yung ICUs were around 65-67%. So, it's going to be problematic for many cases na yung severe or critical pag napuno na yung ICUs natin. And the best ICUs are in Metro Manila, and pag napuno na yun, where will they get admitted?